MPS III is actually a group of 4 disorders. They're called Sanfilippo A, B, C, and D because they each have a distinct enzyme deficiency that ultimately results in accumulation of heparan sulfate. And heparan sulfate is the glycosaminoglycan that becomes deposited throughout the body, but probably is the reason for the neurotoxicity that we see in Sanfilippo. So when I talk about Sanfilippo, it's predominantly a neuronopathic MPS disorder that manifests within the first few years of life of developmental regression and behavioral issues that start to come to light, including attentional difficulties, behavior, impulsivity, so frontal lobe issues. And these children can be diagnosed as autism spectrum, or and their systemic features of MPS are milder. They might not have as frequent ear infections. They may not have the significant airway issues, although that needs to be assessed. They may or may not have sleep apnea. These are all the manifestations that we see in the other MPS disorders. They could have normal growth. They may not present with growth delay. Varying degrees of, less so of hepatosplenomegaly, umbilical hernias, and even the other neurologic manifestations of the MPS disorders, including C-spine compression due to GAG accumulation or carpal tunnel, is not seen as often in MPS III A, B, C, and D. So they should undergo the same baseline assessments as the other MPS disorders, cardiac, pulmonary, and neurologic. But the focus is on treating the behavioral issues and aggressively providing therapies for learning and language. So this is difficult because we do not have an FDA-approved therapy for the MPS III disorders yet. And the therapy needs to target the brain, and therefore it needs to cross the blood-brain barrier. And the conventional intravenous enzyme replacement therapy would not work in this scenario. So we'd either have to deliver enzyme through the CSF space or ultimately deliver it through a viral vector and hopefully correcting the underlying enzyme deficiency permanently.